many times medicine has suffered because people went on conjectures rather than data. Wrong operations were done, people suffered, lost lot of costs was spent, and then later when data came to the rescue, then those bad practices in medicine and bad practices in healthcare were finally stopped. So, just to give you an example, there was an operation in which they ligated the internal mammary artery for coronary artery disease, and it was proved a huge waste, and actually it increased the risk of death in patients of heart attack. So, huge mistakes have been made before, and therefore, there has been a paradigm shift in healthcare where we have moved from what should happen to what did happen. So, we were quite happy with saying bye bye to mathematics after 10th class, but now that divorce has to be reversed, and doctors and journalists have to be taught how to use numbers, how to hear their language, and how to use it in decision making. So, first thing is that any event that occurs in the world can be measured, and therefore it can create data. Now, this data is interesting to us if it is a big good, either it can do a big good or a big bad. And this data, as soon as it is created, it must be captured or recorded. Thanks to electronics and mobile phones and digital data, digital healthcare, which AIIMS Patna uses, this recording is now by mobile phones, which can store the GPS location of the event. So, basically you are interested in three things about the event of interest: the time, the place, and the person. And as soon as this data is recorded and stored, it has to be retrieved where it is to be used, it has to be updated, and it has to be reused, and all this has to be easy. And again, 1.2 crore mobile phones in the country would help us do it, provided we can marry information technology and medicine. After this recorded data, we must be able to analyze it validly so that it doesn't give us wrong information. And this workshop is about how to analyze it properly. Journalists would learn, doctors would learn. It will be video recorded, it will be shown and used again and again. And Rasri avat jaat te sil par parat nisan, karat karat abhyas te jadmat hot sujan. So we intend to record it and use it again and again till we become masters in using it and converting it into information. Then this information must go to the people who will decide to do this or do that, to spend government money on this or that. Those people are policy makers. So we have Dr. Dharmendra Gangwar from the Bihar government, who is the principal secretary of the chief minister, who is attending a panel discussion in the workshop. So policy makers have to start respecting the information that is coming out of data. And one important ingredient of respect is good presentation. So this workshop also teaches us how to get data, how to analyze it, and how to present it well. Powerful, easy presentation in numbers. And then it has to be used and the impact judged before 1347 patients occurred in Muzaffarpur of acute encephalitis, and after our hand wash intervention intensive campaign, only 64 occurred in 2015. So, the impact has to be documented. So, this is the flow of data. It starts when the event is created, and it must be used to cause the maximum benefit to society. I think this workshop primarily links at laying the emphasis on this flow chart and how each of it can be strengthened in Bihar, so that healthcare decision making can be made most cost effective, and in the least resources we can produce the maximum impact in policy and practice of medicine, which is for the sick, and healthcare, which is for the healthy. Thank you.